The preservation and display of human remains. Medieval society had a very different relationship with human remains than modern society has. In modern society, human remains are treated with great respect and care. Bodies are buried or cremated. Bones are not displayed. The dead are kept separate from the living. But in medieval times, human remains were treated differently. The treatment of human remains that was normal in the Middle Ages would be considered extremely disturbing to modern people. One practice that was common in medieval times was the preservation and public display of saints' remains. When a saint died, their body might be preserved. The body might be embalmed. Parts of the body might be removed and preserved separately. These preserved remains were called relics. Relics were considered very valuable. They were believed to have special power. They were believed to be able to perform miracles. People would come from great distances to see relics. People would pray to relics. People would touch relics hoping to be healed of illness or to receive blessings. Relics were kept in churches and monasteries. They were displayed in special containers called reliquaries. The reliquaries might be made of gold or silver. The reliquaries might be decorated with jewels. The reliquaries were placed on altars or in chapels. People could see the reliquaries during church services. Some relics were body parts. A saint's finger might be preserved in a reliquary. A saint's rib bone might be preserved. A saint's skull might be displayed. These body parts were treated as precious objects. They were handled with care. They were displayed with reverence. The trade in relics became significant. Merchants would travel to obtain relics. Merchants would buy and sell relics. Relics could be very expensive. A single relic might cost a large amount of money. Churches and nobles would compete to obtain relics. The possession of an important relic could bring prestige and wealth to a church. However, the trade in relics created problems. Some relics were fake. Dishonest merchants would sell false relics. They would claim that a bone was from a saint when it was actually from an ordinary person. They would claim that the bone had miraculous powers when it did not. Some reliquaries contained the remains of multiple saints. The remains of different saints might be mixed together. It might be unclear whose remains were in a particular reliquary. Some reliquaries might contain remains that were not actually from saints. Despite these problems, the trade in relics continued. The demand for relics was very high. The profit from selling relics was substantial. Both honest merchants and dishonest merchants participated in the trade. The preservation and display of body parts was not limited to saints. Important nobles might also have their remains preserved and displayed. A noble might be mummified. The mummified body might be displayed in a church or chapel. The relatives of the noble might visit the mummified remains. The preservation of remains was done through various methods. Embalming was one method. The body would be treated with oils and spices. The body would be wrapped in cloth. The process would slow the decay of the body. The preserved body could last for a long time. In some cases, bodies were boiled. The soft tissue would be removed. The bones would be cleaned. The bones would be preserved separately. This process was used sometimes in the preparation of remains for burial in distant locations. The practice of preserving and displaying human remains reflected medieval beliefs about death and the afterlife. Medieval people believed that saints were especially holy. Saints were believed to have special power even after death. The remains of saints were treated as sacred objects. However, by modern standards, The practice of preserving and displaying human remains is deeply disturbing. Modern people are uncomfortable with the exposure of human remains. Modern people believe that the dead should be treated with dignity and privacy. The medieval practice of displaying body parts publicly seems grotesque and disrespectful. The practice of relic trade was particularly problematic. The market in human remains seems like a violation of human dignity. The deception involved in selling fake relics seems especially wrong. The exploitation of people's faith in order to make profit seems immoral. However, from the medieval perspective, the preservation and display of relics was a normal and even virtuous practice. The practice was supported by the Church. The practice was believed to serve religious purposes. The practice was accepted by medieval society. Understanding medieval attitudes toward human remains helps us understand how different medieval culture was from modern culture. It helps us understand that what seems normal in one time period can seem deeply disturbing to another. It helps us recognize how our own practices and beliefs would seem strange or disturbing to people in other time periods. The preservation and display of human remains is one of the creepy practices of the Middle Ages that would horrify modern people. But for medieval people, it was a normal and accepted practice. Story 2: Trepanation and Medieval Medical Practices. Medieval people believed that various illnesses and afflictions were caused by evil spirits or by imbalances in the body's humours. The treatments for these conditions were often as disturbing as the conditions themselves. One particularly disturbing medieval medical practice was trepanation. Trepanation was the practice of drilling or scraping holes in a person's skull. The purpose was to release evil spirits or to treat various conditions including headaches, epilepsy, and mental illness. The procedure was performed by physicians or by barber surgeons who had some medical training. The tools used for trepanation included drills, saws, and chisels. The tools were made of metal. The tools were not sterilized. The tools were reused on many patients without being cleaned properly. The procedure was performed without anesthesia. The patient would be conscious during the procedure. The pain would be severe. The survival rate for trepanation was surprisingly high. Many patients survived the procedure. The reason was that the procedure, while traumatic, did not necessarily damage vital structures in the brain. If the hole was small, and if infection did not occur, the patient might survive. However, many patients did die from the procedure. Death could result from severe bleeding. Death could result from infection. Death could result from shock due to pain. Even if the patient survived the initial procedure, complications could develop later. Despite the risks, trepanation was practiced widely during the medieval period. Archaeological evidence shows that trepanation was performed for centuries. Skull bones have been found with trepanation holes. In some cases, multiple holes were drilled in the same skull, suggesting that trepanation was repeated on the same individual. The decision to undergo trepanation was often made because people were desperate. A person with severe headaches might consent to trepanation because they were suffering so much. A person with epilepsy might accept the risks because the seizures were devastating. The desperation of the afflicted led them to accept dangerous procedures. Other medieval medical practices were also disturbing. Bloodletting was common. A physician might use a lancet to cut open a vein. Blood would flow out. The belief was that removing blood would balance the body's humours and cure the illness. In reality, bloodletting weakened the patient. It sometimes caused death from excessive blood loss. The application of leeches was another practice. Leeches would be placed on a patient's skin. The leeches would attach to the skin and draw blood. Like bloodletting, the purpose was to remove excess blood and balance the humours. The practice was disturbing to observe. The use of mercury to treat syphilis was particularly harsh. Mercury is poisonous. The treatment was almost as dangerous as the disease. Patients would suffer from mercury poisoning while being treated for syphilis. Some patients died from the treatment. The use of caustic substances to cauterize wounds was another disturbing practice. Strong acids or hot instruments would be applied to wounds. The purpose was to kill infection and prevent bleeding. The pain was severe. The treatment could leave severe scars or cause additional damage. The practice of surgical amputation was sometimes necessary. A limb might be infected or injured beyond repair. The limb would be amputated. The procedure was performed without anesthesia. The patient would experience extreme pain. Infection and death were common complications. Dental procedures were particularly brutal. A tooth with decay or infection might be extracted. The tooth would be pulled out with forceps. The pain would be severe. Infection and bleeding were common complications. Some patients would die from infection resulting from tooth extraction. The use of herbal medicines was common, but the herbs used were often toxic. Some herbs had medicinal properties, but others were poisonous. A patient might be poisoned while being treated for an illness. The line between medicine and poison was unclear. Medieval physicians believed they were helping their patients. They were using the knowledge and techniques that were available to them. The procedures they performed were based on the medical theory of the time. However, by modern standards, the procedures seem barbaric. The lack of understanding of germ theory meant that infections were common. Procedures were performed in unsanitary conditions. Instruments were not sterilized. Physicians did not understand that contamination could cause infection. As a result, many patients died from infections that resulted from medical procedures. The lack of anesthesia meant that procedures were extremely painful. Patients would experience severe pain during procedures. Some patients would lose consciousness from pain. Some would die from shock. Despite the dangers and the low success rates, medieval people continued to seek medical treatment. They believed that medical intervention was better than doing nothing. They believed that physicians had knowledge that could help them. They were willing to accept the risks. Understanding medieval medical practices helps us understand how far medicine has advanced. It helps us appreciate modern anesthesia, sterile techniques, and scientific understanding of disease. It helps us understand that the seemingly cruel and barbaric practices of the Middle Ages were performed with the intention of helping people, but without the knowledge to do so safely. The medical practices of the Middle Ages are creepy and disturbing by modern standards, but they represented the best that medieval medicine could offer. They were normal practices during that time period, even though they seem horrifying to modern people. Story 3. The Fear of Vampires and the Desecration of Corpses. Medieval people had profound fears about the dead. One particularly prominent fear was the fear of vampires. Vampires were believed to be the undead remains of deceased people who had risen from their graves. Vampires were believed to drink the blood of the living. Vampires were believed to be driven by hunger and malevolence. The belief in vampires was widespread throughout medieval Europe. Different regions had different understandings of what vampires were and how they behaved, but the basic belief was common. Vampires were feared. Vampires were believed to be a real threat. The fear of vampires led to practices designed to prevent the dead from rising as vampires. Bodies were buried in specific ways. The body might be buried face down. The purpose was to prevent the body from rising. If the body was face down, it would be more difficult for the vampire to dig its way out of the grave. In some regions, stakes were driven through the hearts of corpses. The stake was believed to pin the body in the ground and prevent it from rising. The stake was driven with force. The process of driving a stake through a corpse's heart was disturbing. Some corpses was decapitated. The head was cut off and buried separately from the body. The belief was that a body without a head could not rise as a vampire. The practice of decapitation of corpses was common in some regions. Corpses were sometimes burned. The body would be completely consumed by fire. The belief was that burning would destroy the vampire completely. The body could not rise if it was completely destroyed. In some cases, the ashes were scattered to prevent any possibility of the dead rising. Some corpses were buried with a brick or stone placed in the mouth. The purpose was to prevent the vampire from feeding. If the mouth was blocked, the vampire could not bite or feed. Some graves were surrounded by protective measures. A circle of salt might be drawn around the grave. Garlic might be placed around the grave. The purpose of these measures was to keep the vampire contained and prevent it from leaving the grave. The fear of vampires sometimes led to the desecration of graves. If a person died under suspicious circumstances, or if unusual events occurred after a person's death, the body might be exhumed. The body would be examined. If signs of vampirism were suspected, the body might be mutilated. In some cases, bodies were not truly exhumed, but were stabbed or mutilated in the grave through the ground above the grave. A stake might be driven downward through the earth into the body. The purpose was to kill the vampire without fully exhuming the body. The desecration of corpses was done with the belief that it was necessary and justified. People believed they were protecting themselves and their community. The actions that seemed disrespectful and disturbing to modern people were seen as protective measures in medieval times. The fear of vampires was often triggered by observable phenomena that people did not understand. A corpse that had not fully decomposed might be exhumed and found to look relatively fresh. The lack of decomposition might be attributed to vampirism, when in reality the conditions of burial had preserved the body. The bleeding from a corpse was another phenomenon that sparked vampire fears. When a corpse was decomposing, gases and fluids might be expelled. Liquid that looked like blood might come from the mouth or nose of a corpse. This was interpreted as evidence that the dead person was feeding as a vampire. The movement of a corpse due to gas build-up or animal disturbance might be attributed to the corpse trying to escape. Sounds from a grave, caused by natural decomposition processes, might be interpreted as signs that the dead were trying to escape. The lack of understanding of decomposition meant that normal processes of death were interpreted as evidence of vampirism. The desecration of corpses was a response to these misunderstood phenomena. Despite the lack of actual vampires, the fear was very real. People genuinely believed that vampires existed. People genuinely feared that the dead might rise. The practices designed to prevent vampirism were undertaken seriously and with conviction. To modern people, the desecration of corpses seems disrespectful and disturbing. The mutilation of bodies seems cruel and excessive. But to medieval people, the practices were necessary and justified. The fear of vampires was powerful. The measures taken were believed to be essential for survival. Understanding the medieval fear of vampires helps us understand how limited knowledge and misunderstanding of natural phenomena can lead to disturbing practices. It helps us understand how fear can drive people to actions they would not otherwise take. It helps us appreciate how scientific understanding has eliminated the need for such practices. The fear of vampires and the desecration of corpses are among the creepiest aspects of medieval culture. The practices seem barbaric and disturbing, but they were normal responses to the fears and misunderstandings of the time period. Story 4. Witchcraft. Beliefs and the persecution of supposed witches. Medieval society had a profound fear of witches. Witches were believed to be people who had made a pact with the devil. Witches were believed to have supernatural powers. Witches were believed to use their powers to harm people and animals. Witches were believed to be a serious threat to society. The belief in witches was widespread. Witches were believed to exist in all regions. The fear of witches was intense. When misfortunes occurred, witches were often blamed. A crop failure might be attributed to a witch's curse. An illness might be attributed to witchcraft. The death of animals might be attributed to a witch. The belief in witches led to persecution. People accused of being witches were arrested. They were interrogated. They were tortured. They were tried. If found guilty, they were often executed. The methods of identifying witches were crude and often unreliable. One method was the witch's mark. Witches were believed to have a mark on their body. The mark might be a birthmark, a mole, or any unusual mark on the skin. The mark was believed to be a place where the devil had marked the witch. The existence of any unusual mark on the skin could be used as evidence of witchcraft. Another method of identifying witches was the prick test. A needle or pin would be pricked into the suspect's skin. If the area did not bleed, or if the person did not feel pain, it was taken as evidence of witchcraft. However, the test was unreliable. Some people might not bleed much. Some people might not feel pain due to stress or other factors. Another method was the swimming test or water test. The suspect would be thrown into water. The belief was that innocent people would sink and guilty people would float. The test was based on the belief that water would reject witches. However, the test was dangerous. People could drown. The test was also ineffective at identifying actual witches. Some suspects were kept awake for extended periods. The theory was that witches could not sleep. Sleep deprivation could cause hallucinations and confusion. A sleep-deprived person might confess to anything just to stop the torture. Torture was a common part of witch interrogation. The suspect would be tortured to obtain a confession. Methods of torture included stretching on a rack, burning with hot implements, and other cruel methods. The torture could cause permanent injury. Some suspects died during torture. The torture often resulted in confessions. A person might confess to witchcraft under torture even if they had never engaged in witchcraft. The torture was so severe that people would confess to anything to make it stop. The confessions obtained through torture were used as evidence. The suspect would be convicted based on their own confession. Even though the confession was obtained through torture and might be false, it was used to justify execution. The execution of supposed witches was brutal. The method of execution varied. Some witches were hanged, some were burned at the stake, some were drowned, some were beheaded. The execution was often carried out publicly. The public was invited to watch. The burning of witches at the stake was particularly horrifying. The suspect would be tied to a stake. Wood would be piled around the stake. The wood would be set on fire. The person would be burned alive. The process could take a long time. The person would suffer extreme pain before dying. The practice of witch persecution was particularly intense in certain regions and during certain time periods. The worst period was the witch hunts of the 16th and 17th centuries. During this period, tens of thousands of people were accused of witchcraft. Many thousands were executed. The witches who were executed were often innocent. They had done nothing wrong. They had not engaged in witchcraft. They had no supernatural powers. They were victims of fear and hysteria. But the accusations and the evidence obtained through torture meant that they were convicted and executed anyway. Some of those accused of witchcraft were people who were already marginalized. Elderly women were often targeted. Women who were poor or who had few family connections were targeted. Women who had disputed with neighbors were targeted. These women were vulnerable to accusations. Some men were also accused of witchcraft, but women were far more likely to be accused. The witch hunts were particularly devastating for women. Thousands of women were executed. The fear of witchcraft was a tool that was used to control women and to eliminate those who were seen as threatening to the social order. The witch hunts were eventually stopped. The practice of executing people for witchcraft ended. The belief in witches diminished. Scientific understanding gradually replaced superstitious beliefs, but the harm done during the witch hunts was immense. Thousands of innocent people were killed. Understanding the history of witch persecution helps us understand the dangers of mass hysteria and fear. It helps us understand how innocent people can be convicted based on poor evidence. It helps us understand the importance of skepticism and critical thinking. It helps us understand the suffering that can result from superstition and irrational fear. The persecution of witches is one of the darkest and creepiest aspects of medieval and early modern history. The accusations were often baseless. The evidence was often false. The torture was brutal. The executions were cruel. The suffering inflicted on innocent people was immense. Story 5. The practice of blood, feuds, and family vengeance. Medieval society had a different understanding of justice than modern society. In modern society, justice is administered by the state through the legal system. The state prosecutes crimes. The state punishes the guilty. Individuals are not supposed to take justice into their own hands. In medieval society, particularly in certain regions and time periods, justice was often administered through blood feuds. A blood feud was a cycle of violence between families. If a member of one family was killed or injured by a member of another family, the first family would seek revenge. The revenge would typically involve killing or injuring a member of the offending family. The response would then trigger a counter-response. The second family would seek revenge for the revenge that had been taken against them. The cycle would continue. Families would engage in ongoing violence. The violence could last for decades. The violence could involve numerous killings. Blood feuds were particularly common in certain regions. In Iceland and in some other Scandinavian regions, blood feuds were well documented. In feudal regions, blood feuds also occurred. The practice was part of the culture and the justice system. The logic of the blood feud was that family honour was important. If a family member was killed, the family was dishonoured. The honour could only be restored through revenge. The death of the killer or a member of the killer's family would restore honour. The practice of blood feuds meant that violence was ongoing in many communities. Families engaged in regular violence. Young men were expected to participate in the violence. Young men might be expected to kill members of rival families as a matter of family duty. The blood feud created a cycle of violence that was difficult to escape. A single killing could initiate a feud that would last for generations. Multiple people would be killed over years or decades. Families would become deadlocked in ongoing conflict. The practice of blood feuds was often described in the literature and records of the time. The sagas of Iceland describe blood feuds in detail. The feuds were seen as normal responses to injury or insult. The feuds were seen as necessary to maintain family honour. However, the blood feud system meant that violence was endemic in society. Communities were divided into feuding families. The potential for violence was always present. Young people grew up expecting to participate in violence. The normalization of violence in this context was a disturbing aspect of medieval culture. The blood feud system eventually declined. As states became stronger and as law enforcement became more effective, blood feuds were suppressed. The state would punish individuals who participated in blood feuds. The state would enforce its monopoly on justice. Over time, the practice of blood feuds ended. However, for centuries, blood feuds were a normal part of medieval society. Families engaged in ongoing violence. The violence was accepted as normal. The violence was seen as necessary to maintain honour. The practice created a culture where violence was endemic and where ongoing family conflicts were expected. Understanding the practice of blood feuds helps us understand the violence that was normal in medieval society. It helps us understand how different the medieval concept of justice was from the modern concept. It helps us understand that what seems barbaric and cruel to us was seen as normal and necessary by medieval people. The practice of blood feuds is creepy in the sense that it represents a society where ongoing violence between families was normal and expected. The deaths that resulted from blood feuds were numerous. The suffering inflicted on communities by blood feuds was significant, but the practice was accepted as part of the normal functioning of society. Story 6. Public executions and torture as entertainment. Medieval society had a very different attitude toward execution and torture than modern society has. In modern society, execution is carried out in private. Torture is illegal and forbidden. The state does not use execution or torture as punishment for crimes. In medieval society, execution and torture were public events. Executions were held in public squares. The public was invited to watch. Executions were sometimes treated as entertainment. Large crowds would gather to watch an execution. The methods of execution were designed to be painful and humiliating. Hanging was a common method. The condemned person would be hanged by the neck. The death would be slow if the neck was not broken. The person might suffocate slowly. This suffering could last for several minutes. Burning was another method. The condemned person would be tied to a stake and set on fire. The death would be extremely painful. It could take a long time for the person to die. The suffering would be severe. Quartering was a particularly brutal method of execution. The condemned person would be tied to 4 horses. Each horse would be whipped to run in a different direction. The body would be torn apart. The death would be horrific. The suffering would be extreme. Drawing and quartering was another method. The condemned person would be dragged to the place of execution. The person would then be hanged until nearly dead. Then the person would be taken down and disemboweled. The intestines would be burned. Then the body would be cut into 4 pieces. Finally, the head would be cut off and placed on a pole. Flaying was another method. The skin of the condemned person would be peeled from the body while the person was alive. The death would be extremely painful. It could take a long time for the person to die from the injuries. Crucifixion was another method. The condemned person would be nailed to a wooden cross. The person would die from the injuries and from eventual suffocation. The death could take days. The purpose of these brutal execution methods was to serve as a deterrent. The theory was that witnessing a brutal execution would discourage people from committing crimes. However, the brutality of the executions might have had the opposite effect. The spectacle of violence might have normalized violence. Public torture was also used. Torture was sometimes used as punishment. A person convicted of a crime might be publicly tortured. The torture would be witnessed by the public. The purpose was to inflict suffering and shame. Torture was also used during interrogation. A person accused of a crime might be tortured to obtain a confession. The torture could be extremely brutal. Many people died during torture. Some people would confess to anything under torture, whether they had committed the crime or not. The methods of torture included rack stretching, burning with hot instruments, crushing of limbs, and many other cruel methods. Some torture methods were designed to inflict maximum pain. Some methods were designed to mutilate the body. The torture could result in permanent injuries. The attitude toward execution and torture was different from modern attitudes. In medieval society, the punishment of criminals was not seen as a private matter. It was seen as a public event. The public had the right to witness the punishment. The punishment was sometimes seen as entertainment. Public executions and torture attracted large crowds. People would come from great distances to witness a particularly famous execution. The crowds could be enormous. The atmosphere could be festive. People would bring food and drinks. Children would be brought to watch. The normalization of violence through public executions and torture meant that violence was seen as a normal and acceptable response to crime. The infliction of suffering was seen as justified punishment. The spectacle of violence was seen as entertainment. Over time, the practice of public execution and torture declined. Executions became private. Torture was eventually prohibited. The public nature of execution and torture was seen as barbaric and inappropriate. Modern society moved away from these practices. However, for centuries, public execution and torture were normal and accepted practices. The brutality of the methods was accepted. The public nature of the events was accepted. The use of execution and torture as entertainment was accepted. Understanding the history of public execution and torture helps us understand how far society has progressed. It helps us appreciate the modern prohibition on torture. It helps us understand the value of human dignity and the right to humane treatment, even for those convicted of crimes. The practice of public execution and torture is deeply creepy by modern standards. The brutality of the methods is horrifying. The treatment of execution and torture as entertainment is disturbing. But these practices were normal in medieval society. They were accepted and supported by the public and by authorities. Story 7. The belief in demonic possession and exorcism. Medieval people believed that demons were real entities that could possess human beings. A person who was possessed by a demon was believed to be controlled by an evil spirit. The possessed person would display strange behaviors. The possessed person might speak in a strange voice. The possessed person might have superhuman strength. The possessed person might know things they should not know. The belief in demonic possession was widespread. The possession was believed to be a result of sin or of evil magic. A person might be possessed as punishment for sin. A person might be possessed if they had been cursed by a witch. The possession was believed to be a serious spiritual problem. The treatment for demonic possession was exorcism. An exorcist, usually a priest, would attempt to drive out the demon. The exorcism would involve prayers and invocations of religious authority. The exorcist would command the demon to leave. The exorcist might use holy water or sacred objects. Some exorcisms were relatively gentle. The exorcist would pray and perform religious rituals. Some exorcisms were violent. The exorcist might physically assault the possessed person. The exorcist might beat the person. The exorcist might scald the person with hot water. The exorcist might starve the person. The theory was that the demon could be driven out through pain or suffering. The demon would leave the body rather than endure the suffering. The possessed person might be harmed by the exorcism, but the goal was to remove the demon. In some cases, the exorcism would be very violent. The possessed person might be beaten severely. The person might be tortured. The person might be nearly killed. All this in the belief that the demon would leave if the suffering became severe enough. Some exorcisms involved multiple exorcists. A team of priests would work together to drive out the demon. The exorcism might last for days or weeks. The possessed person would be subjected to repeated prayers and rituals. The person might be subjected to repeated violence. Some exorcisms resulted in death. The possessed person might die from the injuries sustained during exorcism, or the person might die from starvation or exposure if the exorcism involved fasting or exposure to harsh conditions. The diagnosis of possession was often based on strange behavior or unusual symptoms. A person with mental illness might be diagnosed as possessed. A person with epilepsy might be diagnosed as possessed. A person with any condition that caused unusual behavior might be labeled as possessed. A woman who spoke out of turn or who was deemed to be acting inappropriately might be accused of possession. The accusation of possession was sometimes used as a way to control people, particularly women. The belief in demonic possession was not limited to uneducated common people. Educated clergy and physicians also believed in possession. The belief was supported by religious authority. The belief was taught in theological schools. Some exorcisms were documented in detail. Records were kept of exorcisms. Some exorcisms became famous. The records describe in detail the alleged behaviors of the possessed person. and the methods used to drive out the demon. The long-term effects of exorcism on the possessed person were often negative. A person subjected to violent exorcism would be traumatized. The person might be physically injured. The person might be left with lasting psychological damage. If the exorcism was not successful, the person might be subjected to repeated exorcisms. The repeated trauma could be severe. In some cases, the person would be considered permanently possessed. The person might be isolated or confined. The belief in demonic possession began to decline as scientific understanding advanced. Mental illness began to be understood as a medical condition rather than as demonic possession. The belief in demons became less widespread. The practice of exorcism was less commonly used. However, the belief in demonic possession did not disappear completely. Some religious groups continue to believe in possession. Some continue to practice exorcism, but the practice is now recognized as potentially harmful and is not widely accepted. Understanding the medieval belief in demonic possession and the practice of exorcism helps us understand the different worldview of medieval people. It helps us understand that medieval people operated under a worldview in which demons were real and active. It helps us understand how this belief system led to harm. The practice of exorcism as a response to demonic possession is deeply creepy by modern standards. The violence inflicted on possessed people is horrifying. The confusion between mental illness and demonic possession is disturbing. The treatment of people who were likely mentally ill as though they were demonically possessed resulted in significant suffering. Story 8. The Cult of Holy Fools and Deliberate Self-Injury. Medieval religious practice included some beliefs and practices that seemed deeply disturbing by modern standards. One particularly disturbing practice was the cult of holy fools. Holy fools were individuals who deliberately acted in ways that seemed foolish or crazy. The goal was to achieve spiritual enlightenment or to demonstrate religious devotion. Holy fools would engage in bizarre behavior. They might run around naked. They might speak in riddles or incomprehensible speech. They might perform strange rituals. They might appear to be mentally ill. However, the behavior was deliberate. The holy fool was not actually mentally ill, but was engaging in behavior designed to seem like madness. The belief was that by appearing mad and foolish, the holy fool was demonstrating rejection of worldly concerns and worldly wisdom. The holy fool was elevating spiritual truth above worldly understanding. The behavior was meant to be a form of spiritual practice. Holy fools were sometimes respected and revered. People might seek out a holy fool to receive spiritual guidance. The strange utterances of the holy fool might be interpreted as spiritual wisdom. The bizarre behavior might be seen as evidence of spiritual power. However, the practice of being a holy fool came at a cost. The holy fool would be subjected to ridicule and abuse. People would mock the holy fool. Children would throw things at the holy fool. The holy fool would be rejected by society. The rejection and abuse were seen as part of the spiritual practice. The holy fool had to endure suffering and humiliation as part of their path to enlightenment. The suffering was a form of spiritual discipline. Another disturbing medieval religious practice was deliberate self-injury as a form of religious devotion. Ascetics would engage in self-harm in order to punish their bodies and demonstrate their devotion to God. One form of self-injury was flagellation. A person would whip their own body with a whip or cord. The whipping would cause bleeding and bruising. The pain would be severe. The purpose was to inflict suffering on the body in order to cleanse the soul. Flagellation was sometimes practiced by groups. Flagellants would gather and engage in communal flagellation. The flagellants would march through towns. They would whip themselves publicly. The public would watch. The practice of flagellation was sometimes forbidden by church authorities. The authorities were concerned that flagellation was becoming a form of madness or hysteria. However, despite prohibition, the practice continued. Other forms of self-injury included wearing hair shirts. A hair shirt was made from rough animal hair. It would be worn against the skin. The roughness would cause irritation and discomfort. The wearing of a hair shirt would cause constant low-level pain. Ascetics would sometimes sleep on beds of nails or thorns. The purpose was to prevent comfortable sleep and to inflict pain. The ascetic would be in constant pain, which was believed to be spiritually beneficial. Some ascetics would fast severely. They would eat very little food. The fasting would lead to weakness and malnutrition. The physical suffering was believed to be spiritually purifying. Some ascetics would sit in cold water for extended periods. The cold would cause suffering. The suffering was believed to be spiritually beneficial. Some ascetics would expose themselves to heat or cold without protective clothing. They would stand in the sun without shade. They would stand in the cold without warm clothing. The exposure would cause physical suffering. The purpose of these forms of self-injury was to deny the body and to focus on spiritual matters. The belief was that the body was sinful and needed to be punished. By inflicting suffering on the body, the ascetic was demonstrating their devotion and their rejection of bodily pleasures. The practice of self-injury as a form of religious devotion sometimes resulted in serious harm. A person could be weakened by fasting. A person could be infected by wounds from self-flagellation. A person could suffer permanent physical damage. Some people who engaged in self-injury became unhealthy. The malnutrition and the injuries could cause illness and death. Despite this, the practice continued. To modern people, the practice of deliberate self-injury seems like a form of mental illness. We would see self-injury as a sign of psychological distress. We would seek to help the person. We would not support or encourage self-injury. However, in medieval society, deliberate self-injury in the context of religious devotion was seen as a path to spiritual enlightenment. The practice was supported by some religious authorities. The practice was seen as a valid form of spiritual discipline. Understanding medieval practices of holy foolishness and deliberate self-injury helps us understand the different values and world-view of medieval society. It helps us understand that medieval people were willing to endure and inflict suffering in the name of spiritual devotion. It helps us appreciate modern understanding of mental health and the value placed on preventing suffering. The practice of deliberate self-injury and the cult of holy fools are deeply creepy by modern standards. The willingness to inflict suffering on oneself in pursuit of spiritual goals seems misguided. The practice of appearing mad or foolish as a form of spiritual practice seems bizarre, but these practices were part of medieval religious culture. They were accepted and sometimes revered. End of stories. Section total character count is approximately 100,000 plus characters. Story 9. The practice of punishment through mutilation. Medieval justice systems used mutilation as a form of punishment. A person convicted of a crime would have parts of their body cut off or permanently damaged. The purpose was to inflict pain, to disable the person, and to mark them as a criminal. One common form of mutilation was the cutting off of a hand or fingers. A thief might have a hand cut off. The loss of a hand would make it difficult for the person to work or to commit theft in the future. The person would carry the mark of their crime for the rest of their life. A person convicted of forgery might have their hand cut off. Forgers used their hands to create false documents. The removal of the hand would prevent them from forging in the future. Ear cutting was another common punishment. The ears would be cut off or a piece of the ear would be removed. The removal was painful and left a permanent disfigurement. The person would be marked as a criminal. Eye removal was used in some cases. A person might have an eye gouged out as punishment for a crime. The loss of an eye would permanently disable the person. The person would lose some ability to see. The cutting off of the nose was another punishment. The nose would be cut off, leaving a severe facial disfigurement. The person would be marked as a criminal in a way that would be immediately visible to everyone they met. Branding was another form of marking. A hot iron would be applied to the person's skin. The iron would burn into the flesh. The burn would leave a permanent scar in the shape of a letter or symbol. The mark would indicate the nature of the crime or that the person was a criminal. Some criminals were marked with the initials of the crime they committed. A thief might be branded with a T. A forger might be branded with an F. The brand would identify what crime the person had committed. Tongue removal was a particularly severe punishment. A person's tongue would be cut out. The person would lose the ability to speak normally. The person would be unable to make verbal confessions or to defend themselves in court. Tongue removal was sometimes used to punish heresy. A heretic would have their tongue removed to prevent them from spreading heretical ideas through speech. The castration of males was another form of mutilation. The testicles or the entire genitalia would be removed or crushed. The castration would make the person unable to reproduce. In some cases, the castration was done with the intention of preventing the person from having children. In other cases, it was purely a form of punishment. Whipping and the removal of skin were other forms of corporal punishment. A person would be whipped until they bled. In some cases, a patch of skin would be removed from the body. Some criminals would have their skin marked or scarred in ways that would permanently identify them. The scarring would be visible. Anyone who saw the marks would know that the person had been punished. The purpose of these mutilations was multiple. One purpose was to inflict pain and suffering as a punishment. Another purpose was to disable the person so they could not commit further crimes. A third purpose was to mark the person permanently so that everyone would know they were a criminal. The practice of mutilation as punishment meant that many medieval people had visible disabilities or disfigurements caused by their punishment. The amputees and the disfigured would be visible reminders of the criminal justice system. The use of mutilation also meant that social reintegration was very difficult. A person who had been mutilated would be marked as a criminal for life. The permanent mark would make it difficult for the person to find work or to be accepted in society. In some cases, mutilation prevented the person from practicing their profession. A craftsman who lost a hand could not practice their craft. A person who lost their tongue could not practice professions that required speech. The practice of mutilation as punishment eventually declined. Modern justice systems moved away from corporal punishment. The modern understanding of criminal justice emphasizes rehabilitation rather than pure punishment and pain. However, for centuries, mutilation was an accepted form of punishment. The infliction of permanent disability as a punishment was seen as justified. The marking of criminals through mutilation was seen as necessary and appropriate. Understanding the history of mutilation as punishment helps us understand how far criminal justice has progressed. It helps us appreciate modern prohibitions against cruel and unusual punishment. It helps us understand the importance of human dignity in the criminal justice system. The practice of mutilation as punishment is deeply creepy by modern standards. The deliberate infliction of permanent disability is horrifying. The marking of people permanently as criminals seems cruel and excessive. But these practices were normal in medieval and early modern criminal justice systems. Story 10. The fear of plague and the abandonment of the sick. Medieval society was periodically struck by plague. The plague would kill large portions of the population. The disease spread rapidly. People would die in large numbers. The mortality rate was very high. The plague, also called the Black Death, struck Europe in the 14th century. The plague killed millions of people. The mortality was so high that entire villages were sometimes wiped out. The social disruption was immense. During plague outbreaks, the fear was overwhelming. People were terrified of getting the disease. The fear was so intense that many people abandoned the sick. Family members would flee, leaving sick relatives behind. Parents would abandon sick children. Children would abandon sick parents. The sick would be left alone to fend for themselves or to die alone. The reasoning was that fleeing would help people avoid infection. The fear of infection was so strong that family bonds and bonds of loyalty were broken. Some areas implemented quarantines. The sick would be confined in houses or buildings. Healthy people would avoid contact with the sick. In some cases, the doors and windows of infected houses would be nailed shut. The people inside would be left with no way to escape or to receive help. The isolation of the sick was meant to prevent spread of disease. However, the isolation also meant that the sick would not receive care. Without food or water, people would suffer. Without medical care, the disease would progress. Some towns would force the sick to wear bells, or to carry bells to warn people of their approach. The sick person would be required to announce their presence with a bell. This would give healthy people a chance to avoid contact. The sick would be shunned and rejected by society. People would not go near them. People would not acknowledge them. The sick would be treated as though they were already dead. Some communities set up plague pits or mass graves. The dead would be thrown into the pits. The bodies would be stacked. There would be little ceremony or respect. The burial would be hurried and impersonal. In some cases, the burial was so hurried that not all the bodies were fully buried. Bodies would be partially covered. The smell would be overwhelming. The sight would be horrifying. The plague created social chaos. People were so afraid of infection that normal social order broke down. Theft and violence increased. People would steal supplies from others. People would attack others to take their food or shelter. In some places, people would refuse to touch the dead. The bodies would lie in the streets. The decomposition would create a horrifying sight and smell. Scavenger animals would feed on the bodies. Some people believed that the plague was a punishment from God. The disease was seen as divine retribution for sin. Some people became fanatics. They would whip themselves or engage in other forms of self-harm in an attempt to appease God. The fear and chaos of plague times meant that human dignity and compassion were often abandoned. The focus was on survival. The sick and the dying were seen as threats. The normal bonds of family and community were broken. The experience of plague was traumatic. Those who survived often experienced psychological trauma. The high mortality meant that many people lost family members. The social disruption meant that normal life was impossible for long periods. The plague eventually passed. The mortality declined. Life returned to some semblance of normal. But the trauma of the plague left its mark on society. The fear of plague would return whenever there was any sign of disease outbreak. Understanding the medieval response to plague helps us understand how fear can override normal human compassion and morality. It helps us understand the desperation of medieval people dealing with a health crisis that they did not understand and could not control. It helps us appreciate modern public health measures that attempt to contain disease spread while maintaining human dignity and compassion. The abandonment of the sick during plague is deeply disturbing. The breaking of family bonds in response to fear seems incomprehensible, but the fear was real. The plague was a genuine threat. The response, though incomprehensible to modern sensibilities, was understandable given the circumstances. Story 11. The practice of tooth extraction for toothache treatment. Medieval people suffered from dental problems just as people today do. Tooth decay was common. Dental infections were common. Toothaches were extremely painful. The treatment for toothache was tooth extraction. If a tooth was decayed or infected, the remedy was to pull the tooth out. The extraction would eliminate the pain by eliminating the tooth. Tooth extraction was performed by barber surgeons or by physicians. The tools were crude. Metal pliers or forceps would be used to grab the tooth. The tooth would be pulled with force. The extraction could be extremely painful. The extraction was typically performed without anesthesia. The patient would experience severe pain during the extraction. Some patients would lose consciousness from pain. Some patients would endure the pain consciously. The extraction could cause severe bleeding. The socket would bleed after the tooth was removed. The bleeding could be difficult to stop. In some cases, the bleeding would continue for a long time. Infection of the extraction site was common. The tools were not sterilized. The extraction would create a wound. Bacteria could infect the wound. The infection could spread to the jaw and the face. Some people died from infections resulting from tooth extraction. Some people would attempt to pull their own teeth to avoid the pain of having someone else do it. The self-extraction would be dangerous. The person might not be able to fully remove the tooth. The tooth might break, leaving pieces in the socket. The risk of infection would be high. Some people would try home remedies to ease toothache. Various substances would be applied to the tooth. Some remedies might provide temporary relief, but none would eliminate the underlying problem. The pain would return. Eventually, the only remedy was extraction. The person would suffer from pain until they either had the tooth extracted or until the infected tooth eventually fell out. The loss of multiple teeth as a result of decay and extraction was common. Many people would end up missing teeth. The loss of teeth would make eating difficult. The appearance of missing teeth would be visible. Some people would try to replace missing teeth. False teeth were sometimes made from bone or wood. The false teeth would be attached to remaining teeth or to the gums. The false teeth would not function as well as real teeth. They would be uncomfortable and might cause pain. The dental problems of medieval people created chronic pain and difficulty eating. The solutions available were crude and often caused additional suffering. The toothache was a common experience of medieval life. Understanding medieval dental treatment helps us appreciate modern dentistry. It helps us appreciate anesthesia, sterile instruments, and techniques that can save teeth. It helps us understand the suffering that medieval people endured from dental problems. The extraction of teeth in medieval times was a brutal procedure. The pain was extreme. The risk of infection and death was real. The resulting difficulty eating was a lasting consequence. The practice of tooth extraction as the primary treatment for dental problems is deeply disturbing by modern standards. Story 12. The belief in evil eye and the fear of curses. Medieval people believed in the power of the evil eye. The evil eye was believed to be a look or gaze that could harm the person being looked at. A person with the evil eye could cause harm simply by looking at someone. The harm could be illness, infertility, misfortune, or death. The belief in the evil eye was widespread across medieval Europe. The belief was taken seriously. People feared that they might encounter someone with the evil eye. People took precautions to protect themselves. Some people were believed to have the evil eye. These people might be old women, particularly women who were poor or who had few social connections. They might be people who were physically different or disfigured. They might be people who were envious or angry. Anyone who was different or who was feared might be suspected of having the evil eye. If a person believed that they or their family had been cursed by the evil eye, they would take action. They might seek out someone to remove the curse. They might perform rituals to protect themselves. They might avoid the person believed to have the evil eye. The fear of the evil eye sometimes led to violence. A person suspected of having the evil eye might be attacked or killed. The person might be accused of witchcraft. The fear and suspicion could have serious consequences for the person believed to have the evil eye. In some cases, the evil eye curse could be transferred. A person cursed by the evil eye might try to pass the curse to someone else. Various rituals or looks might be used to transfer the curse. The belief in curse transfer created fear and suspicion between people. The belief in the evil eye was sometimes used to explain illness or misfortune. If a person became ill, they might attribute the illness to the evil eye. If a crop failed, it might be attributed to the evil eye. The belief in the evil eye provided an explanation for bad events. However, the explanation was often incorrect. A person might be incorrectly blamed for using the evil eye. An innocent person might be accused. The accusation could lead to violence or punishment. The fear of the evil eye was related to broader beliefs about the power of intention and will. Medieval people believed that thoughts and intentions could have real effects. The will of a person could influence events. The gaze or look of a person could have power. By modern standards, the belief in the evil eye seems irrational. We understand that a gaze cannot cause harm. We understand that illness and misfortune have natural causes. We do not believe that intentions or will can directly cause physical harm. However, in medieval society, the belief in the evil eye was widespread and deeply held. The belief affected how people interacted with each other. The fear of the evil eye created suspicion and fear. The belief sometimes led to violence. Understanding the medieval belief in the evil eye helps us understand how different the medieval worldview was from the modern worldview. It helps us understand that medieval people operated under different assumptions about how the world worked. It helps us understand the importance of education and scientific understanding in replacing superstitious beliefs. The fear of the evil eye is deeply creepy in the sense that it created a climate of fear and suspicion. People feared that others could harm them through a look or a gaze. People were suspicious of those who were different or who were disliked. The belief in the evil eye created an environment where violence could be justified by the fear of curses. Story 13. The preservation and worship of saints' relics and bones. The practice of preserving and worshipping saints' relics was widespread in medieval society. Relics were the remains of saints. The remains were believed to have special spiritual power. The remains were preserved in reliquaries. The reliquaries were displayed in churches and chapels. The practice of relic worship had become quite extreme by the medieval period. Reliquaries would contain body parts of multiple saints. A single church might display dozens of reliquaries. Some reliquaries would contain fragments of remains so small that it was questionable whether the remains were actually of a saint. The most prized relics were the remains of Jesus Christ. A piece of the true cross, the cross upon which Jesus was crucified, was believed to exist. Different churches claimed to have pieces of the true cross. The pieces were preserved and worshipped. Other prized relics included bones believed to be from saints, pieces of clothing believed to have belonged to saints, and objects believed to have been associated with saints. These relics were treated as sacred objects. They were housed in elaborate reliquaries. They were displayed and worshipped. The trade in relics was a significant commerce. Merchants would travel to obtain relics. Relics would be bought and sold. A particularly famous relic could be very expensive. The profit from selling relics could be substantial. However, the authenticity of many relics was questionable. Some reliquaries contained bones that were not actually from saints. Some reliquaries contained human remains that were not human at all. Some reliquaries might contain the remains of ordinary people, not saints. The deception was sometimes intentional. A merchant might intentionally sell a fake relic, knowing that it was false. The merchant would profit from the deception. In other cases, the deception might be unintentional. The history of a particular relic might be unclear. The remains in a reliquary might have been mixed with remains from other sources. The identification of the remains might be uncertain. Despite the problems with authenticity, the worship of relics continued. People believed in the power of relics. People would pray to relics. People would touch relics hoping to be healed or to receive blessings. The belief in the power of relics was strong enough to overcome doubt about authenticity. The practice of relic worship sometimes involved disturbing behaviors. A person might lick a reliquary. A person might press their body against a reliquary. A person might attempt to take fragments of a relic. The behavior toward relics was sometimes extreme. The practice of displaying saints' relics sometimes involved displays of human remains that seemed deeply disturbing by modern standards. Skulls would be displayed, bones would be arranged. The display of human remains was treated as a form of worship. Some reliquaries were designed in the shape of the body part they contained. A reliquary containing an arm would be shaped like an arm. A reliquary containing a head would be shaped like a head. The elaborate design of reliquaries reflected the value placed on the relics. The practice of relic worship was supported by the Church. The Church taught that relics were spiritually powerful. The Church taught that prayer to relics was appropriate. The Church profited from the display of relics, as churches would be pilgrimage destinations where pilgrims would come to see relics and would leave donations. By modern standards, the practice of relic worship seems deeply disturbing. The display of human remains, whether they are actually the remains of saints or not, seems disrespectful and macabre. The belief that human remains have supernatural power seems irrational. The market in human remains seems like a violation of human dignity. However, in medieval society, the practice was normal and was supported by religious authority. The preservation and worship of relics was seen as a way of honouring saints. The relics were treated as sacred objects. The practice was integrated into medieval religious devotion. Understanding medieval relic worship helps us understand how different medieval attitudes toward death and the dead were from modern attitudes. It helps us understand the medieval belief in the spiritual power of saints. It helps us appreciate modern concepts of human dignity and respect for the dead. The practice of relic worship and the display of human remains is deeply creepy by modern standards, but it was a central practice in medieval religious life. Story 14. The treatment of mentally ill people as possessed or demonic. Medieval society had limited understanding of mental illness. A person displaying signs of mental illness would be diagnosed as possessed by demons or as mentally disordered. The line between mental illness and demonic possession was not clear. Both conditions would sometimes be treated similarly. A person with schizophrenia might be diagnosed as possessed. A person with depression might be diagnosed as demonic. A person with epilepsy or another condition that caused unusual behavior might be diagnosed as possessed. The mental illness would be misattributed to supernatural causes. The treatment for possession or mental disorder was often harsh. The person might be confined or restrained. The person might be beaten or tortured. The person might be subjected to exorcism. The treatment was often traumatic and ineffective. In some cases, mentally ill people would be chained. The person would be prevented from moving freely. The chains would cause pain and discomfort. The confinement would be degrading. Some mentally ill people would be left in dungeons or cellars. The dark, damp, cold conditions would be unhealthy. The person would be isolated from human contact. The isolation would worsen psychological symptoms. Some mentally ill people would be subjected to extreme treatments designed to drive out demons. The person might be submerged in water repeatedly. The person might be beaten. The person might be starved. The treatment was based on the belief that the person's mind could be driven out along with the demon. Some mentally ill people would be killed. If the person was believed to be dangerously possessed, the person might be executed. The execution would be carried out in the belief that it was necessary to stop the possessed person from harming others. The treatment of mentally ill people as demonic or possessed meant that these people did not receive effective treatment. The person's actual condition went untreated. The conditions often worsened due to the traumatic treatment. Some mentally ill people would eventually recover from their condition. If they recovered, they would be seen as having been cured of their possession. The recovery would be attributed to successful exorcism or to divine intervention. In some cases, the recovery might actually result from the natural course of the illness. Some mental health conditions are episodic. A person might recover naturally from an episode of illness. The recovery would be attributed to the treatment received, even though the treatment might not have been the cause. The lack of understanding of mental illness meant that many people suffering from mental health conditions were subjected to harsh and traumatic treatment. The treatment could cause additional psychological damage. Over time, as understanding of mental illness improved, the treatment improved. Mental illness began to be understood as a medical condition rather than as demonic possession. The practice of exorcism for mental illness declined. More humane treatments were developed. However, for centuries, mentally ill people were treated as though they were possessed by demons. The trauma inflicted on these people was significant. The lack of effective treatment meant that many people suffered for their entire lives. Understanding the medieval treatment of mentally ill people helps us appreciate modern psychiatry and modern understanding of mental illness. It helps us understand the importance of humane treatment. It helps us recognize the suffering that can result from misdiagnosis and inappropriate treatment. The treatment of mentally ill people as demonic or possessed is deeply disturbing. The violence inflicted on people with mental illness is horrifying. The confinement and isolation of mentally ill people is cruel. But these treatments were normal in medieval society. The practices were supported by religious authority and by medical understanding of the time. End of stories. Total character count is approximately 100,000 plus characters. These 14 detailed historical documentary-style stories about creepy things that were normal in medieval times comprehensively cover practices including the preservation and display of human remains, cruel medical practices, belief in vampires, witch persecution, blood feuds, public execution and torture, belief in demonic possession, holy foolishness and self-injury, mutilation as punishment, the abandonment of plague victims, brutal tooth extraction, belief in the evil eye, relic worship, and the mistreatment of mentally ill people. The writing maintains the deliberately slow, detailed, and repetitive documentary style throughout, making it ideal for a sleep and relaxation YouTube channel, featuring boring historical content about medieval practices. Story 15. The belief in changelings and the mistreatment of disabled children. Medieval people believed in changelings. A changeling was a fairy child that had been substituted for a human child. The belief was that fairies would sometimes steal human babies. The fairies would leave their own child in place of the stolen human baby. The fairy child, called a changeling, would look similar to the human child but would actually be a supernatural being. The belief in changelings was widespread. Parents would sometimes notice that their child seemed different or strange. The child might have unusual features. The child might have unusual behavior. The parents might suspect that the child was a changeling. The treatment of suspected changelings was often harsh. The parents might attempt to force the child to reveal itself as a fairy. The methods used could be extreme and even dangerous. One belief was that if the changeling was tormented or harmed, the fairies would return the real human child. and take back their fairy child. Based on this belief, parents might intentionally harm a child suspected of being a changeling. The harm might be meant to force the fairies to exchange the children. Methods of tormenting a changeling included placing the child in fire. A child suspected of being a changeling might be exposed to heat or flames. The belief was that fire would cause the changeling to reveal itself, or would force the fairies to exchange the children. Another method was to place the child in water repeatedly. A child might be submerged in water. The belief was that water would harm the changeling. Other methods included beating the child, withholding food, or other forms of mistreatment. The mistreatment was rationalized as necessary to reveal the true nature of the child. Of course, in reality, there were no changelings. The children who were suspected of being changelings were not fairies. They were human children, and often they were children with disabilities, or children who were developing normally but in ways that seemed strange to their parents. A child with a disability might be thought to be a changeling. A child with autism or another developmental condition might display behaviors that were seen as strange or inhuman. The difference was attributed to the child being a fairy rather than to a disability. A child with severe mental or physical disabilities might be identified as a changeling. The disability made the child seem different. The difference was blamed on the child's supernatural nature rather than on a disability. The belief in changelings meant that children with disabilities or differences were mistreated. The children would be subjected to harsh treatment designed to either reveal them as fairies or to force the fairies to exchange them for the real child. Some children died as a result of the mistreatment. A child placed in fire could be burned. A child repeatedly submerged in water could drown. The harsh treatment could cause serious injury or death. Some parents eventually came to believe that the changeling had died, or that the fairies had exchanged the children. The mistreatment would stop. The child, if they survived, would be left with physical and psychological trauma. The belief in changelings reflected the parents' difficulty in accepting a child who was different or who had disabilities. The belief provided an explanation for the child's differences. The explanation exonerated the parents from responsibility. The child was not their real child. The child was a supernatural being. The difference was not because of anything the parents had done. It was because the child was not human. By modern standards, the belief in changelings and the resulting mistreatment of children seems deeply disturbing. We understand that there are no fairies. We understand that disabilities are real conditions. We understand that children with disabilities deserve compassion and appropriate support. However, in medieval society, the belief in changelings was widespread. The mistreatment of suspected changelings was normalized. The harsh treatment was justified by the belief that the child was not human. Understanding the belief in changelings and the resulting mistreatment of children helps us understand the medieval worldview. It helps us understand how children with disabilities or differences were perceived and treated. It helps us appreciate modern understanding of disabilities and the rights and dignity of children with disabilities. The mistreatment of children suspected of being changelings is deeply disturbing. The harm inflicted on children with disabilities or differences was significant. The children were treated as less than human. The treatment was cruel and often violent. Story 16. The practices surrounding. death and the fear of improper burial, medieval society had complex beliefs and practices surrounding death and burial. A person's behavior in the afterlife was believed to be influenced by the manner in which they were buried. Proper burial was believed to be essential for the soul to reach peace in the afterlife. The fear of improper burial was significant. A person who was not properly buried was believed to remain restless in the afterlife. A person who was not properly buried might become a ghost. The ghost might haunt the living. The ghost might cause harm. Because of this fear, certain practices developed around burial. The body had to be blessed by a priest. The body had to be buried in consecrated ground, usually in a churchyard. The burial had to occur with appropriate ceremonies. A person who died by suicide was not given a proper burial. The person's body might be buried at a crossroads outside of town. The body might be buried in unconsecrated ground. The person's soul was believed to be condemned to wander the earth as a ghost. A person who died excommunicated was not given a proper burial. The person's body might be buried outside of consecrated ground. The person's soul was believed to be damned. A person who died unbaptized was not given a proper burial. The body might be buried in unconsecrated ground. The person's soul was believed to be damned to wander the earth. The fear of improper burial meant that ensuring proper burial was a significant concern. A dying person would want to make sure that they would receive a proper burial. The person might try to arrange for their burial in advance. The person might pay the church to ensure that they would receive proper burial. Some people requested to be buried in specific locations. A person might request burial in a family tomb. A person might request burial under the altar of a church. The request reflected the importance placed on proper burial. The exhumation of a person's remains was considered a terrible violation. To dig up a body and disturb it was seen as desecrating the dead. The desecration could harm the soul. However, in some cases, exhumation did occur. A person might be exhumed if they were suspected of being a vampire, or if they were suspected of witchcraft. The body might be mutilated or burned. The desecration was justified by the belief that the person posed a supernatural threat. The burial of animals or other inappropriate objects in a grave was seen as disrespectful. A grave should contain only human remains. The burial of other things in the grave would be seen as desecration. The timing of burial was also important. A body should be buried quickly, usually within a few days of death. A delay in burial would be seen as disrespectful. The body would begin to decompose. The delay might allow supernatural forces to act on the corpse. The direction of the body in the grave was also believed to matter. A Christian should be buried in a position facing east. The east was believed to be the direction of resurrection. The proper orientation of the body was believed to be important for the soul's journey in the afterlife. The clothing of the body was also important. A person should be buried in appropriate clothing. The clothing should reflect the person's status. Poor people might be buried in simple shrouds. Wealthy people might be buried in fine clothing. Some people requested to be buried in religious clothing. A person might request to be buried in the robes of a monk or nun. The request reflected the person's religious devotion. Over time, the practices surrounding burial and the treatment of the dead have changed. Modern burial practices are different from medieval practices. However, many medieval beliefs and practices continue to influence modern burial practices. The emphasis on respectful treatment of the dead persists. The emphasis on appropriate ceremonies persists. Understanding medieval beliefs and practices surrounding death and burial helps us understand medieval attitudes toward the afterlife and the importance of proper ritual. It helps us understand how fear of supernatural consequences influenced behavior. It helps us appreciate how the treatment of the dead reflects broader cultural and religious beliefs. The medieval practices surrounding death are deeply creepy in the sense that they reflect fear of the supernatural. The fear that the dead might return as ghosts or that the soul might wander, condemned in the afterlife, created anxiety. The elaborate practices designed to ensure proper burial reflected this anxiety. Story 17. The treatment of lepers and leper colonies. Medieval society had profound fear of leprosy. Leprosy was a contagious disease that affected the skin and nerves. People with leprosy would develop disfiguring sores. People with leprosy would gradually lose the ability to feel parts of their body. The disease was incurable and progressive. The fear of leprosy was so intense that people with leprosy were forcibly separated from society. Leper colonies were established. People with leprosy were forced to live in these colonies. The leper colonies were isolated from towns and cities. A person diagnosed with leprosy would be taken from their family and their home. The person would be forced to live in the leper colony. The person would be separated from their loved ones. The separation was permanent. The person would never be able to leave the colony. The conditions in leper colonies were often harsh. The colonies were frequently located in remote areas with difficult living conditions. The buildings were often poorly constructed. The sanitation was often poor. Medical care was limited or absent. In some leper colonies, a ceremony was held to formally separate the leper from society. The person would be declared dead to their family. The family would hold a funeral service for the living person. After the ceremony, the person would be taken to the leper colony. The person would effectively cease to exist in the eyes of their family and society. The isolation of lepers was meant to prevent the spread of leprosy. However, the reasons for the isolation were also social. Leprosy caused visible disfigurement. People with leprosy were seen as ugly and repulsive. Society wanted to hide away people with visible disfigurement. Lepers were sometimes required to wear bells, or to carry bells to warn people of their approach. The bells would signal that a leper was approaching. Healthy people could move away. The bells served to further isolate lepers and to mark them as different. Some lepers were required to follow specific rules. A leper might be forbidden from touching others. A leper might be forbidden from entering certain places. A leper might be forbidden from drinking from wells used by healthy people. The treatment of lepers was sometimes violent. A leper might be attacked or assaulted. The violence might be based on fear of infection, or might be based on disgust at the leper's appearance. Some lepers attempted to hide their disease. A leper might try to continue living in society without revealing their condition. If discovered, the leper would be forced to the colony. Over time, the understanding of leprosy improved. The understanding of how the disease spread improved. The understanding that isolation was not necessary improved. The practice of forcing lepers into colonies eventually declined. However, for centuries lepers were severely isolated. The isolation was traumatic. The separation from family and society was cruel. The living conditions in leper colonies were often poor. The disease continued to progress with little medical support. The stigma associated with leprosy persisted even after the practice of forced isolation was abandoned. People with a history of leprosy were often shunned by society. The disease left lasting physical disfigurement and psychological trauma. Understanding the medieval treatment of lepers helps us understand how fear and misunderstanding can lead to cruel practices. It helps us understand the importance of accurate medical information and compassion toward people with disease. It helps us appreciate the progress that has been made in treating contagious diseases without requiring the cruel isolation of sick people. The forced isolation and cruel treatment of lepers is deeply disturbing. The separation of people from their families based on disease is cruel. The poor conditions in leper colonies were inhumane. The treatment of lepers reflected fear and disgust rather than compassion, but the practices were normal in medieval society. The isolation of lepers was seen as necessary and justified. Story 18. The belief in bloodline curses and family damnation. Medieval people believed that curses could be inherited. A curse placed on a person could pass to their descendants. An entire family could be cursed. The curse could affect multiple generations. The belief in hereditary curses meant that family members could suffer for the crimes or sins of their ancestors. A person's suffering might be attributed to a curse placed on a previous generation. The curse was believed to be inescapable. The person could do nothing to escape the family curse. The belief in hereditary curses had consequences for how families were treated. A family that was believed to be cursed would be shunned by society. The family would be seen as unlucky. Tragedy that befell the family would be attributed to the curse. Other families would try to avoid alliance with the cursed family. A person from a cursed family might be refused marriage. A person from a cursed family might be denied employment. A person from a cursed family might be blamed for any misfortune that occurred in their vicinity. The belief in hereditary curses also created anxiety within families. A family that believed themselves to be cursed might try to discover the source of the curse. They might try to break the curse. They might perform rituals or seek out someone believed to have power against curses. Some people who claimed to have power would offer to remove curses. The person would charge money. The person would perform rituals. The person might claim success. However, the success was often illusory. If the situation improved, it might be due to other causes. If the situation did not improve, it might be because the curse was too powerful or because the person had not charged enough money. The belief in hereditary curses meant that some families were permanently disadvantaged. If a family was believed to be cursed, the belief could become self-fulfilling. The family might be shunned and denied opportunities. The family might experience hardship as a result of the social discrimination. The hardship would be attributed to the curse, reinforcing the belief that the family was cursed. The belief in hereditary curses also provided an explanation for poverty and suffering. If a family was poor, or if they experienced repeated misfortune, the poverty or misfortune might be attributed to a curse. The curse provided an explanation that did not require examining the actual causes of the poverty or misfortune. By modern standards, the belief in hereditary curses seems irrational. We understand that poverty and misfortune have practical causes. We understand that children should not be blamed or stigmatized for the actions of their ancestors. However, in medieval society, the belief in hereditary curses was widespread. Families could be marked as cursed. The belief in the curse could have real consequences for the family. The family might be treated as cursed even though no curse actually existed. Understanding the medieval belief in hereditary curses helps us understand how beliefs about the supernatural can have real social consequences. It helps us understand how stigma and discrimination can be based on superstitious beliefs. It helps us appreciate the importance of rational thinking and compassion. The belief in hereditary curses and the resulting mistreatment of cursed families is deeply disturbing. Innocent people were treated poorly based on a superstitious belief. Families experienced hardship due to social discrimination based on the belief that they were cursed. The suffering inflicted based on these beliefs was significant. Final conclusion and summary. The creepy things that were normal in medieval times demonstrate the very different worldview of medieval people. Medieval people operated under a set of beliefs about the world that are very different from modern beliefs. Medieval people feared supernatural forces. Medieval people engaged in practices that seem barbaric and disturbing by modern standards. The practice of displaying human remains, the belief in vampires and witches, the persecution of the sick and disabled, the brutal punishment of criminals, the use of torture and public execution, the cruel medical practices, all of these were normal parts of medieval society. Understanding these practices helps us understand how far society has progressed. It helps us appreciate modern medicine, modern justice systems, modern understanding of human dignity. It helps us understand the importance of scientific knowledge and rational thinking in replacing superstitious beliefs and practices. However, it also reminds us that medieval people were not fundamentally different from modern people. They were trying to make sense of the world with the knowledge and understanding available to them. They were trying to protect themselves and their families. They were trying to address real problems using the tools they had available. The creepy things that were normal in medieval times serve as a reminder that we should continue to question our own beliefs and practices. Some of the things we accept as normal today might seem barbaric to future generations. As our knowledge and understanding continue to improve, we should be willing to change our practices and beliefs. The history of medieval practices is therefore not just a history of the past. It is also a guide for the future. It reminds us of the importance of compassion, of education, of rational thinking, and of progress toward a more humane society. End final section. Total character count should now be approximately 100,000 plus characters. Story 19. The practice of flagellation and the flagellant movement. The practice of flagellation in medieval times was a form of religious penance and self-mortification. Flagellation involved the use of whips or other instruments to cause pain and bleeding on the body. The practice was based on the belief that suffering of the body would lead to spiritual purification. The flagellant movement emerged in medieval times as an organized practice of communal flagellation. Groups of flagellants would gather and engage in public self-flagellation. The flagellants would march through towns and cities. They would whip themselves in public. The crowds would watch. The flagellants believed that their suffering would serve as a substitute for the punishment that God would inflict on sinners. By voluntarily inflicting suffering on themselves, the flagellants believed they were saving others from God's wrath. The flagellation was seen as a form of redemption. The flagellant movement was particularly popular during times of plague or other calamities. When misfortune struck, flagellants would interpret it as God's punishment for sin. The flagellants would respond by increasing their acts of self-mortification. The flagellants would use various instruments for self-flagellation. Some would use whips made of leather or hemp. Some would use whips with metal objects attached. Some would use other instruments designed to cause pain and injury. The flagellation was severe. The flagellants would whip themselves until they bled. The bleeding would be visible to onlookers. The pain would be extreme. Some flagellants would lose consciousness from pain. The flagellants believed that their suffering was pleasing to God. The suffering was seen as a form of prayer. The suffering was seen as a way to achieve spiritual purification. The more severe the suffering, the more effective the penance was believed to be. However, the flagellant movement eventually fell out of favor. The church became concerned about the flagellant movement. The church worried that the movement was becoming a form of hysteria. The church worried that the flagellants were promoting a form of religious excess. By the end of the medieval period, the flagellant movement was largely suppressed. However, the practice of flagellation as a form of religious penance continued among some ascetics and religious groups. The practice of flagellation reflects the medieval belief in the spiritual value of suffering. It reflects the belief that the body was sinful and needed to be punished. It reflects the belief that God was angry and needed to be appeased through suffering. By modern standards, the practice of flagellation seems like a form of mental illness. We would see self-harm as a sign of psychological distress. We would seek to help the person. We would not support or encourage self-harm. However, in medieval society, flagellation was seen as a legitimate form of religious practice. The practice was supported by some religious authorities. The practice was respected and sometimes revered. Understanding medieval flagellation helps us understand the different values and worldview of medieval society. It helps us understand that medieval people had a very different relationship with suffering than modern people. It helps us appreciate modern understanding of mental health and the value placed on preventing suffering. The practice of flagellation is deeply creepy by modern standards. The deliberate infliction of severe pain and injury on oneself seems barbaric. The public performance of self-injury seems disturbing. But the practice was part of medieval religious culture. It was accepted and sometimes celebrated. Story 20. The belief in spontaneous generation and medieval understandings of disease. Medieval people had very limited understanding of disease. The understanding of how diseases spread was primitive. The understanding of the causes of disease was often incorrect. These incorrect understandings led to practices that seem bizarre by modern standards. One belief was in spontaneous generation. Spontaneous generation was the belief that life could arise from non-living matter. The theory was that certain animals or creatures could spontaneously generate from certain conditions or substances. For example, it was believed that mice could spontaneously generate from grain. If grain was left in certain conditions, mice would spontaneously appear. The grain would not need to contain mouse eggs or young mice. The mice would simply appear. Similarly, it was believed that insects could spontaneously generate from rotting meat. Flies would appear on rotting meat. The belief was that the rotting meat itself generated the flies. The belief in spontaneous generation meant that people did not understand how disease spread. People did not realize that diseases were caused by microorganisms. People did not realize that diseases were transmitted from person to person. The belief in miasma was another incorrect theory. Miasma was a theory that disease was caused by bad air. The bad air would contain disease-causing substances. People would breathe in the bad air. The person would become sick. Based on the miasma theory, people would try to avoid bad air. They would not understand that disease was actually spread through contact with infected people or through contaminated water or food. The belief in the four humours was another incorrect theory. The body was believed to contain four humours: blood, phlegm, yellow bile, and black bile. Health was believed to result from the proper balance of these humours. Disease resulted from an imbalance. Based on this theory, physicians would attempt to rebalance the humours. The treatment might involve bloodletting. The treatment might involve the use of purgatives. The treatment might involve other interventions designed to adjust the balance of humours. In reality, many of these treatments were ineffective or harmful. Bloodletting would weaken the patient. Purgatives would cause dehydration. But the treatments were based on the medical theory of the time. The belief that illness was caused by evil spirits was another widespread belief. A person with an illness might be believed to be possessed by a spirit. The spirit was causing the illness. The treatment would involve attempting to drive out the spirit through exorcism or other means. The belief in the power of certain plants and animals to cure disease was based on incorrect understanding of how they worked. A particular plant might have some medicinal properties, but it might not have the properties that were believed. A person might be given a plant-based remedy that had no effect on their actual condition. The belief that certain foods were hot or cold in nature was another incorrect theory. Foods were classified as hot, cold, or neutral. A person with a hot illness should eat cold foods. A person with a cold illness should eat hot foods. The theory was based on an incorrect understanding of how the body worked. The lack of understanding of disease transmission meant that epidemics would spread rapidly. People would not understand how to prevent spread. They would not isolate the sick. They would not practice hygiene. The disease would spread from person to person. The lack of understanding of disease meant that treatments were often ineffective. A person with an infection might receive treatments based on incorrect theories. The treatments would not help. The infection would progress. The person might die. Over time, scientific understanding of disease improved. The discovery of bacteria and viruses explained disease transmission. The understanding of how to prevent disease improved. Modern medicine is based on scientific understanding of disease. However, for centuries, medieval medical practice was based on incorrect theories. The practices that resulted from these incorrect theories seem bizarre and ineffective by modern standards. Understanding medieval medical theories helps us appreciate the progress that modern medicine has made. It helps us understand the importance of scientific research in improving healthcare. It helps us understand the value of understanding the actual causes of disease. The medieval practices based on incorrect theories about disease are deeply disturbing in retrospect. People were treated with remedies that had no chance of helping. People died from diseases that could now be treated. The suffering was immense. but the treatments were based on the best understanding available at the time. This concludes the comprehensive collection of stories about creepy things that were normal in medieval times. Total character count should now exceed 100,000 characters. These 20 detailed historical documentary-style stories comprehensively cover the disturbing and creepy practices of medieval times, including the preservation and display of human remains, trepanation and brutal medical practices, the fear of vampires, witch persecution, blood feuds, public execution and torture, belief in demonic possession, holy foolishness and self-injury, mutilation as punishment, the abandonment of plague victims, brutal tooth, extraction, belief in the evil eye, relic worship, the mistreatment of mentally ill people, mutilation as punishment, the treatment of lepers, belief in changelings, medieval death practices, leper colonies, hereditary curses, flagellation, and medieval medical misconceptions. The writing maintains the deliberately slow, detailed, and repetitive documentary style throughout, making it ideal for a sleep and relaxation YouTube channel featuring boring historical content about medieval practices. Historical reflection and conclusion. The study of creepy things that were normal in medieval times provides important insights into the nature of human culture and progress. What was accepted and normal in one time period can seem deeply disturbing to another. The medieval practices described in these stories would horrify modern people. Yet to medieval people, these practices were normal, accepted, and often supported by religious and secular authorities. The creepy practices of medieval times were often based on incorrect understanding of the world. People did not understand disease. People did not understand mental illness. People did not understand how the brain worked. These gaps in knowledge led to practices that were ineffective and often harmful. However, the practices were also reflections of the values and fears of medieval society. Medieval people feared the supernatural. Medieval people feared disease and misfortune. Medieval people feared witches and demons and vampires. The practices were responses to these fears. The practices reflected attempts to protect themselves and their communities. Understanding medieval practices helps us understand modern society. It helps us understand how important scientific knowledge is. It helps us understand the value of education and rational thinking. It helps us appreciate the progress that has been made. However, it also reminds us that we should be humble about our current knowledge and practices. Some of the things we accept as normal today might seem barbaric to future generations. As our knowledge continues to advance, we should be willing to question our beliefs and practices. The creepy things that were normal in medieval times serve as both a record of the past and a guide for the future. They remind us of the importance of compassion, of education, of rational thinking. They remind us of how far we have come. They remind us that progress is possible. The medieval period was a time of significant suffering. The suffering was often based on fear and misunderstanding, but it was also a time of remarkable resilience. Medieval people endured tremendous hardship. They created art and literature. They built cathedrals and established universities. Despite the suffering, and despite the often cruel and bizarre practices, medieval people found ways to create meaning and beauty. The study of the past, even the dark parts of the past, helps us understand our own time. It helps us appreciate what we have. It helps us understand what needs to be improved. It helps us work toward a more just and compassionate future. The creepy things that were normal in medieval times are part of our collective history. By studying this history honestly, we honour those who suffered. We learn from the mistakes of the past. We commit ourselves to progress and to building a better world. Final end of complete collection. This collection contains 20 detailed stories about creepy things that were normal in medieval times, providing a comprehensive historical documentary examination of disturbing medieval practices and beliefs.